A short introduction. Dr. Indranill Basu Ray is an interventional cardiac electrophysiologist, a professor of cardiology and public health, and founder chairman of the American Academy of Yoga and Medicine. Such a pleasure to have you with us at Indic Academy.
Thank you. Thank you very much.
Namaste.
Really appreciate that.
Yeah. Just to give a context to this conversation, as a cardiologist, what do you think is the most prevalent disease in the world today?
So yeah, most prevalent disease is heart disease. The largest cause of death is from heart disease. Almost more than 1/3 of all deaths is from heart disease. And the second biggest cause of death is cancer, but heart disease kills twice the number of people than cancer.
Right. And what would be the main cause of the heart disease itself? Are we able to identify and take preventive measures?
Absolutely. So that is one thing really different between heart disease and cancer. So though some of the cancers are preventable, but not all of them are. But heart disease is completely preventable. There's no heart disease that can happen and you cannot prevent it if you take steps early enough. So that is absolutely important to understand, that whatever we suffer from heart disease, people dying suddenly, people having heart attacks, people with diabetes getting blindness or their legs or hands chopped off because they have a peripheral artery disease, all these are completely preventable conditions. And what is the cause that you said? Cause is only one thing. Cause is what we call as inflammation within the blood vessels. So when you have inflammation, so your blood vessels, it must be important to understand, carries nutrition to all your organs, whether it's to your brain, to your heart, to your kidneys, to the muscles in your leg, which you need while you're walking. So when these blood vessels are inflamed, they get blocked, causing heart attack, causing stroke. So they have different names, but basically the disease is only one. When it happens in the brain, it's called a stroke, but it's still blockage of the same blood vessels. When it happens in the heart, you call it heart attack. When it happens in the kidney, you call it acute kidney failure. But so the disease seems to have different names. So people think these are all different diseases. They are not different diseases. There's only one disease, and that is blockages of the blood vessels supplying different important organs in the body.
Is there a component of the mind in this? Is it just biological, physiological, or do people say stress? And can we actually quantify or qualify how the mind can cause these blockages?
Absolutely. So for 2000 years, modern medicine did not believe that stress was an important component. In fact, modern medicine was of the concept that there are only a few diseases which we call as psychosomatic diseases, where brain had an important role in the cause of the disease. Now, in the last 20, 30 years, in the last, say, 40 decades, in the last 4 to 5 decades, there's a radical change in thinking even in modern medicine. So we know stress is an independent risk factor. Independent risk factor means it's one of those risk factors by itself can cause heart disease, by itself can cause stroke, by itself can cause diabetes. So this is a radical change in thinking in modern medicine. So number one, stress is an important component of all these diseases. In fact, a large number of diseases can be completely prevented if you do not have stress. That's number one. Number two, other mental diseases like depression plays a very big role also. For example, if you have a 50-year-old man with, say, diabetes, high blood pressure, and he gets a heart attack, his chance of dying is twice that of another guy of his age and his same risk factors, only if he has depression. So just addition of one depression itself kills you twice more than a normal people. That's number two. Number three is, now we know clearly that this 4 or 5 illness that we call psychosomatic illness is actually not true, because there is strong connection between the mind and the body and the mind. So for 200 years, we thought there were nerves coming from the brain that goes all along the body, and through the nerves, the brain controlled the body. And now we know that's completely wrong. Every second there is transmission of information from the body to the mind, from the mind to the body. Body knows what the mind is doing at every second. Mind knows what the body is doing at every second. And the funny part is that our rishis understood this 10,000 years back.
Right.
And now, not only do we know that they are communicating, every year we are understanding even the molecular and cellular mechanism as to how this is happening. Like, for example, there are blood cells which are like moving transmitters. They are sending drugs and other chemicals that goes to the brain and informing the brain what is happening. Similarly, brain is releasing a bunch of chemicals that is coming to the body and making changes every day. For example, now we know that even your genes can be changed based on how your mind is thinking. If you're always depressed, if you're stressed out, your genes can be changed. And the important part is not the fact that the genes can be changed. The important fact is that you can prevent it by doing yoga. Yoga has got the power to reverse these changes that you get from the brain. So yeah, absolutely. There has been a radical change in modern medical thinking about the role of the brain. There's also a radical change in understanding the science and the mechanics at the molecular, at the cellular, at the genetic, at the hormonal level, how mind and body interacts with each other at every second. And it's vice versa. It's not only mind with the body, also the body also body also understands what mind is doing. Mind also understands what body is doing. So there has been a radical change, and that's why the world over there is this understanding that modern medicine plays a big role, but modern medicine cannot be 100%. You have to bring in things like yoga, meditation, stress relaxation, other wellness techniques to change the mind and change the body so that you don't get diseases.
I was just reading today something where it like you compared a person with who does exercise versus a person who does not do exercise, and the person just by doing exercise can help in preventing heart disease. So would you term yoga as coming under the definition of exercise?
Absolutely. Yoga is a form of exercise. But what you have to understand is that yoga and exercise both are good. Actually, there's been studies with yoga compared to, say, Pilates, compared to, say, Zumba. If somebody with high blood pressure, if they do Pilates versus Zumba versus yoga, yoga is more powerful in bringing down blood pressure. So yoga is absolutely a very good exercise, but you have to understand that exercise is not enough. Physical exercise does not change your brain. It does change your brain, but it changes your brain to a very minimal extent. You have to do exercises of the brain, which is things like mindfulness and meditation to change the brain. Because if you're stressed out, you can do as much exercise as you can. It will not take you much. It will not give you the benefit. That's why I tell, especially because in India now and in the US for many years, the fashion is to just do physical exercise, have a more healthy body, and to look good. Now, the fashion of looking good and having a healthy body is something you'll automatically get when you practice meditation. I mean, there's hardly any Indian saint, who a real saint, not some of the fraud people you see in India today, who don't look good. Look at Adi Shankara, look at Swami Vivekananda. So they are very, very handsome looking. Why? Because that is an automatic, like it's a bypass. It happens whether you want it or you don't want it. Because that glow comes. I think I showed you the picture of my guru. Did I show you the picture of my guru? This is the picture of my guru. Can you see it?
No.
No. Okay, let me. Yeah, okay. Can you see it now?
Yeah.
So see the glow. So you don't have to. But the problem is, material beauty is automatically that comes. So you don't have to try to do it. But that is only 5% of yoga. 95% of yoga is the other techniques, like doing the right breathing. Breathing activates the parasympathetic system. Activation of parasympathetic decreases stress, decreases your chance of getting a heart attack, decreases your chance of getting a stroke, keeps you calm, cool, and reserved even in the worst of stress. Third is pratihara. Pratihara is bringing out your mind from your senses, so that you're not stressed out. Then comes dharana, which is mindfulness, and then comes dhyana, which is meditation. So if you take the entire gamut of yoga, which is far, far more than just physical exercise, your achievement in preventing diseases is way, way more. So this is what I'd say, and really, really, through you, get it out to the people that exercise is good, but it's not enough. Exercise is a small part of yoga. You got to do the entire gamut of yoga to get the benefit.
You mentioned that you started at a very young age of 6. Could you just tell us about how you got initiated into yoga, meditation, and why did you go to cardiac medicine? What is the connect, and how did one lead to the other? Or
Yeah, so what I saw was that, so I started meditation because my father used to sit for meditation. So seeing him, I used to sit for meditation. What meditation I used to do, God only knows. It was just sitting, because when you're a kid, you tend to follow your father and mother, whatever they are doing. You really don't do meditation. You just sit like them, and you believe you did a lot of things. But anyway, that's how I think it all started. Then I started reading books. I read Maharishi Aurobindo. I read the entire Vivekananda's work, and then I started looking for my guru. So I went to multiple people. I went to the head of Ramakrishna Mission at that time. Then I went to meet the Shankaracharya. I think the Shankaracharya was at that time Chandrasekhar Bharati. He was a triple PhD, very simple man wearing just a single cloth over his entire body. So I went to meet him in Kanchi, and then so I met a bunch of people. So I wanted to have a guru. So the question of guru is very important, and a spiritual description is very important. So you have a lot of gurus nowadays who come from a very poor family, and they landed up in some ashram. So after 60 years, they become a big guru. So that's not the definition of a guru. If you stay in an ashram for 60 years, that doesn't make you a guru. Or you give Ram Katha and you become a big guru. The reason is that guru is something who has everything, and then he leaves that to take sannyasi. So if you have something that is not there and you go to a place because of that, because of filling up of a deficiency, then the deficiency remain all your life. You might have a spiritual life, you might have everything good, but that doesn't really make you a guru. So I was looking for a guru who had everything, who left everything and went. And plus I had wanted to have a guru who had a scientific basis, because what we have seen is that there has been a complete divorce of spirituality and religion from science in Hinduism. That is very sad, because Hinduism is one religion where science comes first, then comes philosophy, and then comes religion. Hinduism, unlike Christianity or Islam, is not completely divorced from science. Because if you believe in science, you are anti-God. There are some of the topmost scientists who are almost going to the gallows for having said that the earth is not the center of the universe at the world. 10,000 years back, when the people, entire Western world were Neanderthals or going around naked in the jungles, at that time, 10,000 years back, we told the world that we are multiple universes, which the world is saying, which the Western world is saying now. So nothing in Hinduism is beyond science. There are certain things in Hinduism which science might not understand now, but is understanding more and more. For example, who are the biggest Hindus in America today? The biggest Hindus in America today, or biggest Hindus in this planet, are not those thousands of Indians going around who think they are Hindus and who are they are some of the topmost nuclear scientists, physicists, astronomers. Why? Because they understand that if we have a religion which has got a prophet, and then there's a father, there's a son, then my next question is, who's the father of the father? So this is the most democratic. Advaita Vedanta is the most democratic religion in the universe. There is no father, there is no son, there is one creation. And the whole universe is one. You start from the same place, you end in the same place. You and me are Shiva himself. So Shiva cannot be a guy with 6 snakes going around his neck, because it doesn't matter how big or small he is. The reason is the universe is infinite. The master of the universe cannot be a finite entity. So what is Shiva? Shiva or Param Brahma is a state of existence. And they were very clear about it. If you look at the Rig Veda, the initial Nyaya Sutra, it clearly says that the gods were created after universe was created. So who created the universe? We don't know. This is Rig Veda, which according to the most conservative people is at least 4,000 to 5,000 years old. Some people say it's over 10,000 years old. So 10,000 years, 6,000 years old, even I take the most conservative estimate, 10,000 years old, though probably it was much, much older. It was written down maybe 6,000 years old. Even then we know that so-called gods, goddesses are just small entities. They are not the ultimate. So this concept, so what we have found is this. So my understanding was it has to be scientific. Like what Swami Vivekananda said. So then I started looking for a guru, and I said, my father took me to different places that I wanted to go. And finally, funnily, something happened, and then I met my guru. So my lineage is of course a very, very powerful lineage called Kriya Yoga. I do not know, I just say a little bit about it. So the powerful lineage starts with Mahaavatar Babaji. Mahaavatar Babaji is supposed to be Gorakhnath. So the Nath is one of the most powerful sannyasi groups. So it was started, the first Nath, do you know who the first Nath is? The first Nath is supposed to be Shiva. And then he gave the A to Matsendra Nath, and Matsendra Nath, the disciple, is Gorakhnath. So Babaji is supposed to be Gorakhnath. So he still has he doesn't have of course, his physical body, but he can appear in his Sthula Sarira, which is the subtle body. And of course, 2,500 or 3,000 years old. And his disciple in physical body is Lahiri Baba. Lahiri Baba's disciple is Yukteshwar Giri. Yukteshwar Giri's disciple is Paramhansa Yogananda and my guru. So Paramhansa Yogananda, as you know, was the guy who spent Hinduism most in America after Swami Vivekananda. So, and Steve Jobs had only one book in his iPad all his life, and that is Autobiography of a Yogi, written by Paramhansa Yogananda. And he said that in his Stanford lecture. So when he actually died, everybody, including the then president of America who went to his funeral, that is Barack Obama, got a copy of that book. So my guru took most of his Kriya from Yukteshwar Giri, and he took one Kriya from Paramhansa Yogananda also. So he was both disciple, he was both brother disciple of Paramhansa Yogananda, plus sort of a Upaguru also was Paramhansa Yogananda, because he took the higher Kriyas from him. So that's where it is. So when I was extremely small, when I started this, so I used to call my guru Dadu. Dadu is a Bengali term for grandfather, because he was already 70 then. And so he wanted me to go into medicine, particularly into cardiology. So though we use our brain, but the actual way of spirituality is in the heart. That's what Adi Shankara said. Brain is just to determine what is right and what is wrong. But love, spirituality, all the higher thing, gratitude, all comes from the heart. So love is not, so the whole universe is one, okay? So I cannot say, okay, I love my brain, but I don't love my hand. So when you're in spirituality, you slowly understand that there are no, like you look like a different person to me, but you're actually not different. The whole universe is one single. So all this higher level of consciousness, higher level of emotion that comes, which is love, gratitude, lack of judgment, all this comes from the heart. So he wanted me to be a cardiologist who could spread the science of yoga on a scientific basis. I guess what Babaji wants is that slowly we are receding into a place. Yoga is getting accepted everywhere in the world, including some of the topmost scientists believe in yoga. So it is very important that we present yoga on it both its side. We present both the spiritual side as well as the scientific side. Whatever scientific we know, we need to present that. Yoga, unlike, it's not like a religion which says you have to sit in this fashion, you have to sit in that fashion, you have to look this side, only then you get God. I mean, what is south, what is east, what is west, what is north? There is no south, east, west, north for the universe. Jupiter has a separate west, you have a separate west, I have a separate east, everybody is separate, depending on where you are. So, universe, even the world, the Hinduism has never fixed up religion that you got to get up at 6 o'clock and brush your teeth or do this or do that. No, because universe cannot have a religion. They cannot have a set of rules for everybody. That becomes a cult. That is no more a religion. And that's why Hinduism is not a religion. It's a way of life. I might never go a temple. That doesn't make me a lesser Hindu than, say, you who goes to temple twice daily or thrice daily. Because if thrice daily going to the temple makes you happy, you do that. I cannot also comment and say that what you are doing is wrong because you are going to temple. No. Who am I to judge on what you are doing? Similarly, you should not be judging what I am doing also. That is the greatness of Hinduism. There is no rules, there is no regulation. The only rules and regulation is that when you practice meditation, when you practice mindfulness, you join with the universe, the whole universe. There's a saying which Ramakrishna said, it's like the relation with the mother and with a child is the same relation with a human being and God. Why? So when the child cries for something, the mother will break the universe to provide that to her child. So the universe is there to provide everything to you. So there is no reason. So when that is the truth, then why should we not ask the universe for everything rather than asking for smaller things here and there? So that is what it is. We have to understand that. So when he said heart, so you need to do cardiology. The importance of cardiology medical is also important because, as I said, heart disease is the greatest killer. Despite massive development in technology, massive development in AI in medicine is most used in cardiology. I mean, cardiology has the world's latest instrument. We can map every. I like my job. I go inside the heart without cutting anybody's chest open. So I have to have a good map of the heart. How do I get the good map? I can get a beautiful map of the heart, and I can send you pictures of that by world's latest technologies. Use three-dimensional modeling, AI, name it. I mean, world's topmost computer scientists are sitting and working on this to create all these things. Despite that, we find the number of deaths is increasing. So we have lost something in between. What have we lost? We have lost the understanding that human being is a complete whole. I cannot just think of the heart as an individual entity. I cannot think of the liver as an individual entity. I have to think as a whole. When we think as a whole, we realize that we have not been understanding that human mind plays a big role in my entire existence. And that's what modern medicine is understanding. And to me, as a cardiologist, I think we can play a big role with people like you supporting us to get the people out to the common people. See, there's so many young people who died. Yesterday, one of those MPs, I forget her last name, I think her name was Priyanka something. She was initially in the Congress and then she joined Uddhav Thackeray's party. She brought up in the parliament that so many young Indians are dying. Yes, 35, 50 years of age, they have sudden cardiac death. Some of them are film artists, film actors, bodybuilders, super healthy people. I don't remember all the names, and even in America, we had Elvis Presley, the father of pop, her daughter, she just simply died. And that's called sudden cardiac death. In America, 300,000 people die every year. So every 2 minutes, somebody is dying in America because of this sudden cardiac death. And they are not diseased people. They are not old people. They are not. They don't have a bunch of diseases. Some of them are super young, healthy. Some of them do exercise, have massive muscular body. They are just dying suddenly. So I think that is what there is a connection between the heart and the mind and the body and the connection between the mind and the brain and the heart. And this connection is reflected in the fact that so many people are dying due to heart disease despite the fact they are so called healthy. And that's where I think yoga plays a role, because some of these connections are very subtle. There is play of energy at a higher level of existence, not at the physical body level. Like as a cardiologist, I see everybody's heart, I see their blood every day, but I don't get to see the chakras. Why? Because chakras don't exist in the material body. It exists at the higher level of existence. So there have been connections at the higher level, which as a cardiologist, if we at least not find out the connection, we can at least work on those connections to decrease suffering. There are hundreds and thousands of people. I mean, imagine that the guy who died, he was in Big Boss or something like that. I don't follow all the celebrity media that much, but night he lives with his mother. His mother, early morning, she came, called him up to give him tea, and he was dead. So all these sufferings are there. I mean, there are few which comes in the media, so you and I know it. There are hundreds and thousands of this occurring every day. These are young people who are the bread earners for the family. Imagine to an old father and mother, their only bread earning child dies suddenly. So I think that's where we need to bring in yoga as a science to prevent cardiac deaths, to prevent people from suffering, and also bring in spirituality to take people to the next level of existence where they can live a more healthy as well as a happy existence. And that's my connection, because my guru wanted to bring the science of yoga on a scientific platter to the world.
So last time you mentioned a book where non-Indians also have contributed, as well as Indians from premier
Correct.
region. Could
So
you
the
talk
book is
about?
called The Principle and Practice of Yoga. If you go to Amazon, both in India and in America, and you just type my name.
Mm.
So this is the book. It's called The Principle, and can you see my screen?
Yes, I can.
Yeah. So this is called The Principle and Practice of Yoga in Cardiovascular Medicine. It's printed by this is by over 79 authors from all over the world, including from Harvard, from Emory, from top Indian institutes also, NIMHANS, PGI Chandigarh, AIMS Delhi. So this is written by over 79 authors from all over the world. The second book that we are coming out is another book. So this, as you see, the back cover about the author and everything. The other book we are coming on, which is going to be published by world's number one medical publisher. This is the world's number one publisher, the world's number one medical publisher. That is this book. This will come out early next year. Yoga for Cardiovascular Disease and Rehabilitation. Integrating complementary medicine into cardiovascular medicine. This is by Elsevier, which, as you can see, all the books you see behind me, cardiology, all the top cardiology books are published by Elsevier. This will be published by Elsevier early next year. Is going to come out.
So the authors of the first book, you said they talk about yoga and without having any formal or spiritual background connect to India. So are we taking out the context of yoga when we do studies like that?
No. So both yes and no. So that's where I need to has to be very careful. So one of the biggest problem in modern medicine is modern medicine wants to take a protocol outside its philosophical content and see if it works. So that is what they have been trying to do with yoga. They have stripped yoga with a lot of philosophy and done it. And the funny part is that it still shows benefit. But obviously the benefit will be much lesser. So we are one of the people who have been working on this for the last 20 years, making people understand that some of the modern medicine techniques don't work. They don't even work in modern medicine, and they work very less in yoga. Why? Because yoga is a treatment that has a large amount of brain component in it, mind component in it, emotional component in it. Let me give you an example. You have an infection by some bug, say staphylococcus infection. So whether you're sitting in Antarctica or where do you live, Archana? You live
Bangalore.
in Bangalore. Yeah, whether you live in Bangalore or you're sitting in Mars, if I give you an antibiotic that kills staphylococcus, the result will be same. Okay.
Right.
So modern medicine has been following that. But the problem is that most of the modern medicine does something called RCTs, randomized clinical test, which means that here there should be no bias at all. So the guy who's giving the drug should not know what drug it is. The guy who's taking the drug should not know what drug it is. Some guys will get the real medicine, some guys will not get the real medicine, and then we have to compare those two. So that is the crux of modern medical research. First of all, that doesn't work. Why? You cannot do that in cancer. Somebody is dying, or in heart attack, severe diseases. How can I give somebody with a cancer a drug that doesn't work just to compare whether another drug works? So that is ethically not wrong. Number one. Number two, in some of the trials, even when you can do things like that, it was found the doses used for the trials, you cannot use them on a common person, because most of the common person are so sick, you can use such high doses. So modern medicine needs to change itself. Because in yoga, things are totally different. Whether you're sitting in Bangalore, or whether if you're sitting in Bangalore and you're depressed, a particular yoga technique might not work that well. You might sit in the snow of the Himalayas or Antarctica and you're not depressed. That particular yoga technique will work better, because mind has a big role to play. So modern medicine has to understand that. They cannot take 400 years old technology and try to push it down our throats and say, this is the technique, you have to follow that. So I am one of the scientists who has been fighting that for so long. That's why these books and all these are coming out. So yes, to some extent it has been stripped out and done. But the good thing is yoga is so powerful, even if you strip it out, you will still get that 5, 10%, 15%, 20% benefit. Not 100%, but you will still get it. That's why it's still there, even after 10,000 years. We had thousands of years of, say, Muslim rule, British rule. They killed all the original texts. Nalanda was burned for 7 days. Despite that, whatever is left, that itself is so powerful that it still works. And that's where we are coming in. That's where people like you should need to get this to outside people, that scientific technique has got its own limitation. Just like anything in the world, everything has a limitation. And we have to understand and accept that limitation, and with open hands open up yoga. Because I'll give you one example. See how, even Indians, they behave in such, I wouldn't call it stupid, some childish way. I remember I used to say but my grandmom used to do a bunch of pujas, and she used to do a lot of my father's mother. She used to do a lot of rituals. So what she used to do is, like, Monday used to be some Shiva's day and she will not eat. Tuesday would be some other day, and Lakshmi's day. I don't remember what day for what goddess, but long story short, she used to eat one, or she used to just drink water, or she used to drink, have only fruits. She lived till 90, 95, never had any cancer, never had any heart disease, was not obese. In 2017, so she is by definition of so-called super educated IIT, IIM corporate graduates of India, a stupid old lady doing rituals. That is how they'll be describing her. But her description completely changed in 2017. Why? Because somebody got a Nobel Prize in 2017 for intermittent fasting. Now, whether she does in the name of Hanuman or Shiva, or because somebody got a Nobel Prize, it doesn't matter. But effectually, she lived till 90 plus. should
Of course.
never spend one single 24 hours in any clinic or in any hospital.
Hmm.
So that is the problem, that we are more educated, we are going through IIT, IIMs, we are becoming corporate leaders, and then we are becoming more and more dumb.
Hmm.
We are looking like monkeys for Western support to our system. Why? You don't want to do for Hanuman, you don't want to do for Shiva, she wants to do it, fine. You do it for intermittent fasting. Nobody's asking you to do for Hanuman. There is a doctor in San Jose who does water fasting,
Hmm.
just like what my grandmom used to do.
Good.
So now she is no more, she's a cool lady, she's no more a stupid old Indian lady doing all these rituals. Why? Just because our so-called super educated IIT, IIM corporate graduates think it that way. So our thought, the problem is not with her or
Hmm.
with the modern graduates. The thought is with our brain. How we feed our brain. The moment you get substantiation from a Western source, it looks very cool to us.
Hmm.
When it comes from 10,000 years old technology, it's very old, it is very bad, very stupid, very ritualistic, all these terms come.
Hmm.
So that is what we have to understand, that these have been there for 10,000 years. There's scientific basis to it. Scientific basis has been lost. Like they say, there's a story which goes, you should not sleep with your head on the
Oh.
in the north.
Hmm.
Why? Because Ganesh did that, so his neck was cut, and they had to put an elephant's neck on him. So the question is, that's true. You should not sleep with your head on the north. The reason is the earth is also a magnet. Our brain is a magnet. So if your magnet collaborates with a bigger magnet, then there will be interaction. So you'll be more likely that you'll have more less deep sleep. So you should sleep with your brain in the south.
Hmm.
Now, to make it, see, if to 10,000, 5,000 years back, if a sannyasi, somebody say like Buddha, told this to his disciple, he had to use a story like this, because he would not have told them in terms of magnets and all
Magnet.
this. Because the guy who's hearing him would have said, what this crack guy is talking about? What is a magnet?
Hmm.
Now we have that education, so we can tell it in scientific terms. So they made simplistic story about very important fundamental scientific concept and told it to people.
Hmm.
That doesn't mean they're all a bunch of nonsense.
Yeah.
Does that make sense to you?
Yes, yes.
Yeah.
I do.
So we have newer techniques called N-to-1 technique, by which we need to do these studies, so to prove the yoga works. And more people are opening up to that, these techniques, so that we can use those techniques to prove how yoga works, because we are slowly understanding that mind plays a big role in everything. So you cannot cut off the mind and believe that you would do a scientific study and prove something or disprove something.
So, is there a lot of funding available? Clearly, funding for interventions in cancer or for other diseases would be for drugs, and which can be life saving at a very critical stage. So, how do
Unfortunately,
you? Yeah.
there is a lot of funding for drugs, because these are coming from private companies which make billions of dollars.
Hmm.
Governmental funding at least in the US has come down. The National Institute of Health can only fund 11% of people who apply. So it's trickling down.
Hmm.
But there is almost no funding for yoga. Which company will spend millions of dollars to do research in yoga where they have no interest in that?
Hmm.
Nobody will. And that's why institutions like yours, Indica, should come up and help people, so we can do actual research and show to people. Because pharmaceutical companies, their interest is in making money. Their interest is not to keep you healthy.
Hmm.
Our interest is how you can keep yourself healthy without going to a doctor, without going to a pharmacist, without paying a lot of money for your medical insurance. And then even after paying a lot of money, trying to fight with the medical insurance to actually get paid when you're really sick, because at that time they are nowhere there.
Hmm. Yeah.
So that is what, so we have to create a second network of organizations, of funders who can fund these sort of projects. Because see, India is in a dangerous situation now. With India has become the capital of diabetes. So India will possibly have more heart attacks than America in 2025.
Hmm.
Because India has much more bigger population than US, 3 times more population.
Mm.
So, and India has got what is called malignant coronary artery disease. That means you have younger people having more severe heart disease,
Mm.
and many of them actually kills.
Mm.
So, with this malignant situation going on in India, you have to be very, very aggressive. Now, India is becoming a bigger financial power, but even the biggest financial power like US, UK has broken down because of coronary heart disease, because of heart disease, because it takes like 2,000 or 3,000 times more to pay for a heart patient than pay for, say, malaria or a TB. There are hundreds and millions of people in India who cannot afford a complete TB drugs also because they are so costly to them. How do you think they will be affording a bypass surgery or affording a stent? No. So we have to come with a secondary mechanism. We have to come out of the box thinking.
Mm.
And out of the box thinking comes from the practice and popularization of yoga as a technique which you can publish in your sit and practice in your own home without going to a doctor, but from a yoga therapist who understands yoga clinically.
Mm.
Just because somebody can stand on their head for 10 years doesn't mean that he's a great
Mm.
yogi. No, that's like a monkey can also do it. Train a monkey, it'll do it.
Mm.
The question is not that. You have this monkey shows in the streets of India and they do all those funny things. Does the monkey become a yogi? No. Similarly, yoga needs formal knowledge, formal training like a clinician to become a yoga therapist.
Yeah.
And most of Indian yoga institutes do not provide that amount of knowledge. They don't themselves have their knowledge. How can they provide it to their students? So we need to create that atmosphere where they not only understand clinical medicine to the extent they need. I'm not saying everybody has to be a doctor. No,
Mm.
but they have to have basic understand of clinical medicine as well as basic understand of the science behind yoga, and then practice so that people can sit in their home and practice without having to go to a doctor.
Mm. So thank you so much, sir. And any last final words of think for both doctors, modern allopathy doctors, like we have addressed the yoga community, what they need to do. But in terms of modern doctors who are now being churned out of the numerous medical schools in India, I mean, we don't have a complementary academic route for studies.
Physicians should know yogic, but more and more physicians in US are actually training to understand yoga as a practice, especially when you have so many millions in even in United States of America who practice yoga. They're going to come and ask you questions. If you do not know, it's going to be difficult. So in
Mm.
India also, that's what my advice would be: understand yoga and how you can inculcate that in your practice, because if you don't do as a allopathic doctor, some uneducated people will do it, and the problem with that is that it is the patient who will suffer
Mm.
because they will not get the scientific understanding. So doctors from all color, not only allopathy, naturopathy, ayurveda, should understand the science of yoga and practice it so that you don't have charlatans taking over and making money and fooling people.
Yeah.
So yeah, we have two courses. We have a LMS system which I'm going to talk with I think Hariji about it. And this LMS system is, so we are like an aggregator institute, like just like Amazon. It's like Amazon sells everything from everywhere. It doesn't manufacture
Mhm.
anything. So
Yeah.
we want to bring all the yogic knowledge all over the world, from yoga teachers, from scientists, from physicians, into one platform so that people can use that
Mm.
for their benefit. Because there are a lot of people in India who spend 60, 70, 80 years learning a lot of things, a lot of techniques, and then they die and everything is lost.
Mm.
So we want to create an archive where all these things are stored for posterity. So we have LMS courses for physicians. We also have LMS courses for yoga teachers so that they learn yoga therapy.
Mm.
We are actually in one university in the US. We are actually giving our courses.
Yeah.
So our idea is to provide these courses to more university or through more institutes all over the world, so that they can have a glimpse of this. And these are all scientific. They'll be talk the actual science,
Mm.
actual research, so they can learn yoga in the right sense of the term and then take it forward or actually treat their patients based on that.
So, what would be the most effective way of convincing the patient? I mean,
So I think
yeah.
the
Mm,
most convincing way would be maybe to do a regular YouTube, because people like videos more than talking and
mm,
reading. People hardly read nowadays, which is, and our attention span has also decreased to a few seconds. Even if, like a couple of decades back, it was in minutes. Now it's in seconds. So they want to go from one video to the other. So I think one of the easy thing is to have physicians like me, or have a series of program on YouTube where we talk about different diseases and how it helps, and see if we can make this viral. So that will be a very powerful scheme to do this. Second is having talks in the so-called IITs, IIMs, so that people who come out, they're young people, they have a long life, corporate life of 30, 40, 50 years.
mm,
So before they're young and before they go out in the field, they understand, because this will help them also, because when you in the corporate boardroom, you undergo a lot of stress. How you can protect yourself? You don't want to be spend 15 or 20 years studying and then die in 5 years after you join a corporate board because of having a heart attack.
mm.
So it is for their benefit also. So these are the certain things I think we can take it forward. And as more and more of this intellectual people understand it, they will percolate down to common people.
Thank you so much, Doctor. It was lovely talking to you, and we hope we can work together in taking this message forward.